everyone, welcome to PWN Talks. I'm Kanupriya Agarwal and we are talking about what to focus on in 2025. Today's session is super relevant for all of us women because we are going to talk about hair care. Hair, you either hate yours or you love it. There's no midway, right? But we want to make sure that you love your hair. And for that, we have with us our hair experts today, two sisters, Dr. Samidha and Dr. Teertha. Dr. Samidha and Dr. Teertha run a digital hair clinic based out of Mumbai, serving with the goodness of homeopathy since 18 years. They follow a virtual first approach, which means the consultations are online and your medicines are delivered at your doorstep. You don't end up traveling or waiting unnecessarily, and you can take their treatment from anywhere at all. So, welcome, doctors, to PWN Talks.
Thanks for the warm welcome, Kanupriya.
Okay, so we'll move on to the questions. As you know that we had taken questions from our audience before we did this interview, so I will be asking those as well as my own questions. So firstly, I'm very keen to know that how did you both think of being in the exact same profession? Because obviously this is not something that you can really inherit, right? You need to have the intelligence and inclination for it. So how did this happen?
Yeah. So actually what happened is during the pandemic, actually we can say we saw a lot of cases, those who didn't even have an infection, they had a lot of hair problems. Like almost 90% people had hair fall, like bad cases, we can say that. And there was a lot of misinformation everywhere. Like, you know how the web works. There's a lot of information. Out of that, misinformation is more than the correct information. So we were into practice previously only. But we thought as a doctor, it's our role, to get you the, give yourself or give people the right information, what's right, what to do, and more importantly, what not to do. So that's why we focused on, a complete hair care solution. Like it was high time going digital. Like it was not possible for people to visit. And then the only way was digital. So we found out a solution. Like we found out a team, we collaborated, sorry, we collaborated with a team so that we could go globally, and wherever our patients are there from the comfort of the home, they could reach out. So that was the entire focus, not just treatment. It was about giving them tips, what to be done, the preventive part, the treatment part, and also the maintenance part. So giving the right information and from the safety of the home. So that's why we decided, just focus on just one part, at least for time being. And then let's see how this goes. But when you focus on something, it expands. So when we thought it will be just a short period of time, they will be focusing on one thing, and then we'll start about other health problems also. But then people started coming in, and then it just it went, kept on coming cases, and then just it went in the same direction. It was like, now we need to focus on certain things. So it just started.
So I have this question for you people, that since you both are sisters working together, how is the working equation? And do you guys have conflicts? How do you handle it?
See, there are difference of opinions at times, but we being sisters and in the same profession, okay, we come to a point where there is a mutual this thing. We come to a point where we agree. That's a part of our upbringing also, because from the start, we have been together, and actually collaborating with your sister is it's more easy than going out, collaborating with someone else, because the understanding is more. That's what I can say. And anyways, if you form a company and if you try to form a team, you always see that you the other person should have the differences, a different, so that you get everything. So I see myself as a creative person, and she's good at organizing. So actually we complement each other in that way.
That's nice. This question was in my mind since a long time. Okay. So a lot of people have asked about hair fall, and not just for themselves, but also for their children. Okay. Like 10-year-old, 13-year-old. So I know that, people come to you for hair fall, and it's not something you can tell in one session because obviously personalized treatment is needed. But if you can just share something about hair fall, how it can be managed, or, is it a concern for kids, like anything to do with hair fall. Yeah.
So we can just maybe start with simple things. I will not get into the technical part, but just simplify the topic. And whenever a person just comes to me and says, like, especially a woman, I need a solution on hair fall. It's not the hair fall actually she is looking for. It's the hair thinning solution. What actually she is there, right? She's come there. So I'll come to that. So what is hair thinning basically? So for that, you need to understand there are two basic things which are happening in the hair. It's hair shedding and it's hair loss. So hair shedding means a lot of hair are falling off. Like for example, on an average, there are 100 strands which fall off every day. That's absolutely normal. But if it goes beyond 150 or 200 hair strands, then we say it as hair shedding. That is, more number of hair are falling beyond the normal thing, beyond the normal average. That is hair fall. And the other part is hair loss. What means hair loss? That is whenever, because of any underlying condition, your hair is not growing. So whenever hair are not growing back, that's hair loss. And if it is just an imbalance and more number of hair are falling off, it's called hair shedding. So there are two different major cases, hair fall and hair loss, and there are two different approaches to both these cases. So it's not that every case is just a hair fall, it's two different things. Okay. So that's the main thing.
But can you share like any tips so that people can, I'm just talking about hair fall. Like suppose they have like more than 100, more than the regular number of hair falls. So what can be done? Like, does shampooing regularly, does oiling help actually? People say that, you should oil your hair. So does it help?
So we can start with a basic hair care, what actually hair care routine should include. Yeah. So let's start with hair wash. Now, even before hair wash, that's a particular thing you need to do detangle. Detangle is very, very important. What people do, they just wash their hair and then take a large brush and then try to detangle them. But that's a wrong method. You need to detangle, get those knots corrected before even hair wash. Then do the hair wash, and during hair wash, there are two important steps that you need to keep in mind. That is, do not use hot water at all. It should be mild one. And the second is not the extreme also, not cold water also. Because, people have that myth.
If you use hot water, it will strip away your hair's natural oil which is present and cause more frizz and damage. And on the other side, if you use too much, because there's a myth, if you use cold water, there is a saying, it's like it will add shine. It doesn't add shine to your hair. The shine comes from within. You have to have a balanced diet, stress, and there are other factors. So instead, go for lukewarm water. Instead of hot water and cold water, you have to choose in between. That's a lukewarm water. That's the best solution to wash your hair. That with the shampooing your hair. The first part is the cleansing part. And don't overdo it. How many people ask this question to us? How often should you wash your hair? That basically depends on your type of hair, whether it's a thin hair, thick hair, or you have thick curls. So every person, it depends on the type of the hair. Okay, then accordingly you have to do that. But not more than 3 to 4 times a week. Not every day especially. Because every day if you go and shampoo your hair, even if with warm water also, the natural hair oil which is secreted to keep it, to add moisture and shine, okay, that will go off and will become more frizzy and dry. Okay, so do not shampoo your hair every day.
Okay.
Unless otherwise required.
Yeah. That's the first part. The second part is conditioning. So people say whether to condition or whether not to condition. So we say that after every wash, you should use a conditioner.
Correct.
Now, what type of conditioner, again, depends on the hair. But we generally say you can use a conditioner if done in the right way. That is only applying on the lens and not on the scalp.
Correct.
And just wash it off within 2 minutes. Not just keep it for 10, 15 minutes. 2 to 3 minutes is enough. So that's the only work it has. So that is conditioning. And after that, whenever you are going to, dry your hair, either you do it naturally, and if you don't have that much time, if you want to go for dryers, then use a low heat setting for just 10 to 20% of to dry off. Not a complete 100%, but just 10 to 20% and on a low heat. So it's better in that way, because what people do, they wash and they what if they are, you want to go to office, you're supposed to travel, and they just take that hair along. That's not a correct way, because that will attract dirt. So a low heat setting is allowed, but not often. If you have time, you can let it dry off naturally. And other ways to use, cotton towels or, microfiber towels. They help you dry it off in a
also
faster way.
a white tooth comb.
Yeah, of course.
For detangling, especially.
Yeah.
Not otherwise, you will end up pulling your hair strands and will see more amount of hair on the floor.
Yeah.
then
And
you
should
just
we use that thing to tie the hair with those fancy things that come in the market? Like instead of using a tie, that thing like a hat,
Yeah,
whatever.
got it.
No,
That
that
basically it's a microfiber. That it's the basic thing. It's just make it easier way. It's a microfiber towel only. It is just made it so that you can put it easily. That's it. Either use a towel, use that. It's up to you.
Yeah. Tell me one thing. Do you people have hair fall?
Yeah, hair fall is there in every person. The average is 100 strands. If it's more than that, then it's not normal. So every person is going. There's nobody there's somebody
no one in the world
will say I have zero hair fall. Everybody will have.
Okay, nice. So moving on, like we people, because women in Powai, how many times they visit salons, etc. So people have this question that are these treatments any good, or they cause side effects like Botox, cysteine, or whatever the new age treatments are there, which salons keep recommending. So what do you have to say? Ye sab karna chahiye ya it's best to be avoided?
Being doctors, we will advise best to be avoided. But
Achha.
since in some professions you have to do, or the need of the hour for some women, as you said, especially the entrepreneurs, women entrepreneurs we are talking about. Okay?
Yeah.
But see to it you keep a gap. Don't overdo it. Like
Correct.
I said in the anything which is overdone, which will lead to hair fall. Okay. So you have to space that thing. I mean, every month or every twice a month. I mean, that frequency has to be taken care of.
Okay.
And if at all, if you are suffering from severe hair fall, we would recommend do not go for any such chemical treatments, because that will add on to your hair fall.
Of course,
because those have chemicals. Those have chemicals. Some have in milder this thing, some have in a major this thing. Okay?
Yeah.
So better to avoid. But if you want to do it, see to it, you space out those treatments once in a year or something like that. That's what she said.
Yeah, I mean, if it's very necessary.
Frequently.
Yeah,
the necessity.
Yeah. Okay. So tell me one thing, like how does one tackle the issue of dandruff and flaky scalp? And I want to know that is it something to do with what we eat also, or only external factors? Because people relate it to hygiene, but I think it's more to do with internal things also. Dandruff, what do you have to say about that?
See, dandruff basically, if it all, people, everything categorized into dandruff. So we categorize it into three things. Either it's a dandruff, or it's a product buildup, or it's an underlying condition like a seborrheic dermatitis or a psoriasis, which also looks like a dandruff in the initial stages. They all look similar. So we need to find out what's the problem. If it's a product buildup, then you have to change your products, because there are some, conditioning shampoos or where which after using those products, end up looking like a limp hair. So those contain moisturizers, more conditioners in that. So that leads to product buildup, and then that lead to dandruff, like dry hair or product buildup. The second is internal condition where the treatment is required. So seborrheic dermatitis and the psoriasis needs treatment. It's related to scalp. And the other is hygiene. But as you said, diet is also very important. Other thing is either people ask like, if my hair are big, my scalp is becoming dry, should I use oil or not? So you can use it, but you should not keep it overnight. The best part is just half an hour or maybe just 20 minutes before you hair wash. Just apply oil, but that too very gently, not the chumpy thing. Not very, very generous way.
Not hot oil again.
Okay, not hot. The normal oil, the normal coconut oil.
Temperature, at the normal temperature.
Lekin,
don't heat it.
But the
and
thing
then just wash it off.
But the thing is that I have seen that usually when you go to these massage centers or whatever salons, when they do this oil massage, they usually do it with a hot oil. They say hot oil massage. I mean, I'm also not a fan, but that's what I have noticed. And also, I've observed, and this is what I also tell people, that if you apply oil, then you tend to shampoo more vigorously, obviously, to remove that oil. So, obviously, hair fall will be a little more, right? If I shampoo my hair now,
Yes,
I'll not be rubbing it so much. So I think that also people should factor in, right, while applying oil.
Yes, correct. Yes.
Yeah. Okay. So another thing that I had to ask about dandruff only. So how do, like people say that applying lemon on the scalp or something like that helps in dandruff. Does it help? Rubbing lemon.
See, lemon actually it's vitamin C, and it is age-old therapy. Like once before even you had those anti-dandruff shampoos coming up in the market, all you had is lemon and also curd. People used to apply curd also. So those are age-old remedies. At that time, the lifestyle was completely different. But in today's lifestyle, we are traveling and there's a lot of dirt, there's a lot of chemical. We are exposed to a lot of chemicals. So only applying lemon or a curd might not help. Now, again, it might help in some people, it might not help in others. So the best part is to go for a proper anti-dandruff shampoo. Now, the contents may vary according to the person, but a normal shampoo will not, not work in a dandruff case because those are formulated in a different way. And anti-dandruffs have contents which will act on your dandruff, to wash it off. So you need to have a proper anti-dandruff shampoo. Your normal shampoo will not, help you.
Yeah.
So you can use it if it's effective, but along with the anti-dandruff shampoo. Only that is not going to help.
Got it. Got it. Okay. What do you have to say about graying of hair? Like, because some people say that it happens early also, like to children, it's happening very soon. So is it like something to do with, like lifestyle, or what is it to do with? And secondly, can it be reversed? Graying of hair.
See, premature graying, people have misunderstood that. Premature graying, we only label those if it is, within 15 years. 15. Earlier it was 20s. 2025. But now
It's
if it is beyond
less than 20.
less than 15 years, then we label it as a premature graying. Because you see as early as 8 to 10-year-old children also. So one of the major causes what we have observed, it's a change in the food habits. Now it's related to the inflammation. Anything that's going to cause inflammation in your body is going to trigger the problems. And what is the major problem? First is a lot of sugars. Every packet packaged food, especially junk food, packaged food, there's a lot of sugar in that. The high sugar content is directly proportionate to the inflammation in the body. Second is the preservatives. Now you need to preserve a lot of food. So there are preservatives, chemicals and preservatives. Now these are again the cause of inflammation. So that is second thing. So these and the other chemicals, pollution and chemicals. So those have triggered this early change. And the second is an underlying deficiency. Now, if you have more of junk food or only particular type of food, then you are bound to have nutritional deficiencies, especially micronutrient deficiencies. You might have abundance of food, but it's not a proper food. It's not a balanced food. Micronutrient deficiencies are there. So that is leading to those early graying. Basically it's the melanin formation is not going to happen. The pigmentation is not there. That's why it happens. But what we have observed, those who have access to more food, junk food or packaged foods or having more sugar content in the food are more likely to get.
Those children are more prone to these things, premature graying.
Oh, and you are saying
also genetic also.
Okay, and you are saying nothing can be done about it, like like once you see a gray hair, can something be done about it?
The new hair growth can be black, but not
the one.
Once it is already gray, you cannot reverse it to black because it's already out. Hair has come out of the shaft, it's going to grow for 3 to 7 years, and then it's going to eventually fall off. So how will it reverse? It's not going, it's already dead. After 3 to 7 years, it's already dead. It's come out. It's going to fall off. But instead of that, if your nutrition is good, if all the environmental, if you're in good environment, then the new hair growth might be affected, but only up to 15 years. Beyond that, it's just an aging process which doesn't get reversed. So we are not into those
Gray hair
reversals.
Yeah, yeah. So do you have any suggestions, for naturally dyeing of hair, like to color hair? What can people apply at home? Do you have any suggestions for
See,
that?
anything, there are basic two things. There are natural dyes and there are chemicals, chemical hairs. Now,
Yeah.
with the thing with the natural dyes is sometimes you get allergies, Now, a natural dye, usually people prefer henna. Henna is what color? After apply, you see brown color. If you see something, in the market, which is telling you it's a black henna, how can henna be black?
That has to be a chemical.
Yeah. People are marketing it as a black henna, but you don't find a black henna
There
naturally.
is nothing such as black henna.
So it has to be a chemical, right? Whatever chemical it is. And whatever product you use, you have to do a patch test. That's very important. You might be allergic to it. You don't know. You go behind something natural, but it's going to end up giving you allergies. So, and the other thing is about the dyes, about the colors. Now, if you are going to use on a red color or the different dyes, there are different, degrees of what we can say. Basically, if anything which is consisting of a chemical, it's going to cause problems. So how much to use, when to use, or use how often to use, that's more important. It's if you're going to use a color, it's going to damage your hair, that's for sure. How much to use and how often to use, that's up to you. That's a personal choice. That's usually we say.
If you do that thing frequently, then you tend to lose more hair in the long run.
Of course.
I mean, I've seen people doing for every weekly, 15 days, 1 month, within 3 months or 2 months, okay, but not every week or every 15 days. That will cause more hair fall in the long run.
Like, I have never colored my hair, but I have this feeling that, coloring hair makes it a little more dry. I mean, that's what I feel, that it makes it a little rough. So, I think it's a cycle. पहले आप color कराओ, फिर कुछ cysteine या botox कराओ, फिर कुछ कराओ, फिर कुछ कराओ. And the whole thing just keeps continuing. इससे अच्छा आपके पास आके दवाई ले लो. And then so,
rewinding circle.
Yeah,
absolutely.
So this was really interesting. But lastly, I want to know that what all services do you people provide, and how effective is it, and how much time do these treatments take?
See, right now what we are focused is, we are focused only on hair thinning cases. Now, hair thinning cases can be, anywhere from related to stress. It could be perimenopausal. It could be, somebody who's doing a sudden reduction in weight, sudden weight loss. Then there's hair thinning. There's post-delivery or postpartum hair loss. There is thyroid related. There is PCOS related. It's diabetes related. There is underlying deficiencies. Then there are, people who have done a lot of chemical treatments previously, but they now want to shift over to something natural or maybe general something. So there are a lot of causes leading to hair thinning, and we are specialized into this thing particularly because you don't have anything. If you don't do anything like any kind of medicine or any kind of treatment in hair loss cases, you're bound to lose hair. That's a fact because that's mostly called female pattern hair loss. In such cases, you can't, just depend on lifestyle changes or maybe diet or on just, different relaxation techniques. You need some form of medicine in such cases. So we are focused on hair thinning cases. So what we did is we try to make it simple for people, because people don't have that much time, especially those who are into IT. They have, anywhere that work starts at 5 p.m. and ends at 3 in the morning or 2 in the morning, depending on what type of work schedule or US or UK or Australia time they have. So we bound a new solution, that is a digital solution to that. Like, instead of they coming to us directly and physically in our clinic, it's better they come to us through our digital clinic. Just they have to visit our website, do a register, make the payment. your appointment is scheduled, we take an entire case after that, detailed case where we understand all the problems.
What we come to
What's
the
the
root
cause?
cause of the
Yeah.
hair of the disease.
What's the cause
What the
behind
exact cause
basically?
behind the hair fall?
And
Yeah.
a personalized treatment is given to them. Personalized as in only homeopathy. It's a pure homeopathy practice and only homeopathic medicines are given. And then we do it a regular follow-up for them, monthly, 3 monthly, etc. Now, such cases take a long time. Anything which is related to hair is bound to take a long time to see the results. Now, so we have those packages like a month package or 3 months, 6 months, yearly, 2 yearly packages, so that we get those regular follow-ups, because people tend to forget a follow-up. They come to the, they take a consultation and then aa jayenge, kal jayenge, or maybe not, they're not regular, or they don't follow consistently. So for that, we found out a better way is to give them a 1-year membership, and then regularly monthly, 3 monthly follow-ups is being done through our team. So that is a better way. So this is something we've come up with.
And we don't endorse any products. We don't do any treatment, because if being an online this thing, okay, you are not. We just take the case, detailed case taking is done. Then we arrive at a disease, what is the diagnosis, and then medicines are dispensed through courier. But we don't do any procedures in what PRPs and things like that, because we believe that our medicines are such works wonders. Okay,
So
so
these
instead of those
treatments are not
treatments and
needed.
all,
So these treatments
Not
are not
required.
not
in such
required.
cases.
okay. Okay. Yeah, because
And
Yes,
even
somebody.
no local applications.
yes, yes.
Even no local
No
application
local-
is required.
No local, only the medicines.
That's it.
We give
Okay.
only medicines, no oils, no serums, no shampoos, no conditioner, no products are given from our side.
That's
We see to
great.
it patient,
Mhm.
we see to it what the patient is using, and just a little alteration is done from our side if that thing is if required. Otherwise, we have there are people who give a big list of things.
Mm.
You have to use this particular shampoo, this conditioner, this serum. But this is not required. The external things are just temporary. If you find the exact cause of your hair fall, no, the medicine works wonders. These all things are not required at all. So
Yeah,
there's no
makes sense.
from our side to
Yeah.
buy anything.
Yeah, makes sense. So with that, we come to an end of this session, and it was really helpful. I'm sure these women are waiting to listen to you both. If anybody has any, specific problem, they can reach out to you, right, for personalized solutions. So thank you so much. It was wonderful.
Yes.
you so
Thank
much
you
for
so
having
much,
us.
Karen Priya, for having us.
Yeah. Okay. Bye bye.